we're going to move on to our next speaker. I'm going to introduce Drew Langloh of United Way to you. I think many of you already know Drew. He has dedicated his life to serving underserved through the United Way movement. He originally came from Arlington, Virginia. He has a degree in social work from University of North Carolina, Greensboro. Go Tar Heels. Not exactly Tar Heels, but Tar Heel State, like I'm from. In 1991, he moved to Birmingham to work with the United Way, and at that time completed his MBA at Samford University. In 1999, he moved to Baltimore, where he was a senior vice president with United Way of Central Maryland, and then he became president and chief professional officer of United Way in Delaware in 2004. Came back to Birmingham in 2008 as president and CEO of the United Way. He's really a big believer in tackling some of the complex problems that we have in our community. He believes in using creative approaches to that. He believes in partnering, using this type of process we're doing today to come together to focus on solving problems together in our community. He's involved on many, many other boards. I won't list them all. Just congratulations is in order for just achieving a new target for their campaign, almost $38 million raised in this year's United Way campaign. So congratulations, Drew, on that. In his career so far, he has helped raise $790 million for charity. And I will just note also that after this meeting, Drew will be taking over as chair of the Health Action Partnership leadership team. We have a 2-year rotation, so I'll be stepping down. Drew will be taking over between now and our next leadership team meeting, which will be in March. Our organizations will be working together to make that transition. So Drew, come on up and tell us about the Bold Goals Coalition.
Mark, thank you for that kind introduction. Good morning, everybody. We are fortunate, and I have to say this, we are so fortunate to have a leader like Mark Wilson, who's been chairing this effort, this Health Action Partnership for quite some time, but not just Mark. It's unique in a community to have a health office, a health department that is this engaged in this kind of work. And it is a real asset for our community that Mark and his team at the health department really see the value in this work. And we couldn't be where we are today as a group, as a movement, if it wasn't for Mark's leadership and his whole team really leaning in and saying, this is a core part of our work. So Mark, and to all your team, we're very grateful for all of you. They are not going away, by the way. This is an all-hands-on-deck deal. It's just a matter of who's going to be printing up the agendas and pulling the meetings together for the next couple of years. And by the way, there are three different lead partners that rotate the chairmanship, and my good friend Chris Nani is sitting back there in the room, and in 2 years he gets to take over the lead, and then it comes back around to the health department. So I'm going to talk a little bit about the Bold Goals Coalition, and I see a lot of familiar faces, so I'm going to do another survey. How many folks here have been involved in at least one meeting of the Bold Goals Coalition? A lot of the same faces. And so, but that's great. And so maybe some of you all seen these slides before. So the Bold Goals Coalition of Central Alabama is a large group of community partners. It's not the United Way Bold Goals. It is the Bold Goals Coalition of Central Alabama. And that's really important because there are lots and lots of partners who got together and said, we have a vision for our community on how we might be able to work together differently to go after some big, hairy problems. How can we align ourselves and our efforts in a way that we have a chance at tackling some do some upstream work and go after some of these big problems. And you see sort of this idea that it provides a space collaborative space for organizations to come together and make a greater impact than they can make on their own. So what does collective impact look like? Well, I'm going to pull all these up here. There we go. If you look at the bottom, I call this individual impact. And who here has been involved in outcome measurement in the past? Yeah, we all are big on outcome measurement, and that's really important. And usually down here in individual impact, you've got a lot of organizations that are doing a great job helping people. And they can measure that they're helping people, and people are better off because of their interaction with these organizations. And as you start to move up this arrow, what you see, they're not necessarily working in alignment. As you start moving up the arrow, some of these groups will get together and say, hey, we should start sharing best practices and see how each other does things. Let's have conferences and meetings and share and see how things are being done. And by the way, it looks like we're working on the same issue. And you start to get folks say, yeah, we're all working on the same issue, but we're still doing it independently. We're measuring it our own ways. We're still very internally focused about how we see success. And then as you sort of get to the top of this column or this stack here, what you end up with is a group of organizations that say, let's pick a common goal around this work. Let's agree on a common set of metrics. So we want to shoot for a goal. We want to agree on how we're going to measure our progress against that goal. And then let's use the data to create this continual improvement loop. Let's not use the data to say how good or bad we are, but let's use it to say, okay, what did we do? Let's use a common measurement tool so we're all looking at the same data the same way, and then say, okay, so now let's get together and figure out which approaches seem to be working, which ones didn't, and how we can improve and continuously improve to get towards that goal. And when you get into that zone, you start to see you all get lined up. And you start to line up around a central outcome. And that's what this group of organizations are shooting for, this idea of alignment. What it doesn't mean is that everybody in the group gives up their own organizational agenda for the common good. What it means is everyone in that group probably has a piece of their agenda that is lined up with these goals and metrics. And we see that happening again and again. Groups saying, yeah, I'm interested in all these things, but this piece of my agenda sits squarely in this coalition work, and I can advance it faster with the group than I can on my own. And so that's what we're working on, and that's sort of the theory of change behind what we're doing. So, but this is not your old way of collaboration or coalitions, and we've all been at these tables in the past where we put together a collaboration or coalition, and we all come together, a group of like-minded people. We sit around the table, we agree earnestly about what the problems are, we leave, and we come back 3 months later and we have the same discussion, right? And this is about a deliberate way of moving things forward. And so we talked about this idea of common agenda, I've talked about this idea of shared measurement, of looking at each other's activities and reinforcing using the data what's working and what's not working. This idea of continually talking back and forth, communicating with each other in regular communication venues. And then finally, creating a backbone organization that provides the support to keep the coalition driving forward, keeping it accountable. Kind of like the 3 backbone organizations do for the Health Action Partnership. Mark's team, with Mark as the chair over the last several years, and I see Bryn sitting over there, and all the team, they've printed the agendas, they've called the meetings, they've made sure that the things people agreed to in the meetings are happening. They're sort of doing all the follow-up so that when we come back together, it's not just the same discussion, but we're actually moving down the road. And that's what backbone organizations do. And so in this bold goals arena, United Way, out of the box, committed some time and some energy and some people to providing some of that staff support to the many folks that are actively engaged in this work. So and by the way, there are 3 three groups in that bold goals work. One group is focused on education, one's focused on health, one's focused on financial stability. The health group set its goal that all of the central Alabama communities would be, and that would be Jefferson, Shelby, Walker, Blount, and St. Clair counties, would be ranked in the top 10 for health outcomes in the state of Alabama by the year 2025. And that's based on an RWJ, Robert Wood Johnson county health assessment that comes out every year that looks at a number of factors that determine the relative health outcomes by county. And by the way, we have one county that ranks number 1 and one county that ranks number 66. Jefferson County ranks 25 out of the total of all the counties in the state. So that's our goal. When we look at our mission and vision, the vision is people living, playing, and working, and playing in Central Alabama will enjoy a complete physical and mental well-being, and that we will align resources to ensure equitable access and aggressive prevention efforts that will lead to healthy living and complete well-being. That's some tall drink of water. So we started having discussions, and a lot of it was at the urging of a lot of you in the room, because you were coming to Bold Goals Health meetings, and then you were coming to 2020 meetings, and you were coming to Jefferson County Health Action Partnership meetings, and they all kind of seem to be going together. And they said, this doesn't feel as collaborative. Maybe we should be looking at how we can align all these activities together. So we pulled the leadership team of the Jefferson County Health Action Partnership, Walker County Health Action Partnership, as well as the Bold Goals leadership team together, and said, what should this look like? What we came up with is a structure that looks something like this. And the idea behind it is that, that we would have multiple health action partnerships that are geographically based. And the thinking right now is sort of by counties. And there's already 2 health action partnerships in place, and you're going to hear from Dr. Hamner in a little bit about Walker County. And that each health action partnership team, or each health action partnership, would have priority groups like we have now. So that doesn't really change. But also an added element in that structure would be a community engagement council in many of them. And the idea there is, as we listen to a lot of the voices in the room, the idea that the coalition is really a coalition of providers and not necessarily folks on the ground who need services. And so the idea of creating a community engagement council that advises the work of each health action partnership came up. And so our thinking is that as we move along, certainly in the Jefferson County Health Action Partnership, and possibly in others as they come along, that these community engagement councils will become a part of the structure. And then for each county base, there would be a leadership team, just like Jefferson County Health Action Partnership has a leadership team, and so does Walker. But there'd be a leadership team to help drive the work of each one. Sort of that next level, this idea of really taking what was the Bold Goals Coalition leadership, merging it with the Health Action Partner leadership, and just creating a broader Health Action Partnership Advisory Council. And we have 2 names for it. I don't think we've settled on a name yet. Either the Healthy Central Alabama Advisory Council or the Health Action Partnerships of Central Alabama Advisory Council. Either way, it's an advisory council, and the work of that group would be to help drive and promote the work of the Health Action Partnerships. We would also be there to help make connections and help link communication between multiple health action partnerships, and really be there to help facilitate the work. Also, on an annual basis or so, help provide some level of region-wide accountability, where health action partnerships would be reporting out saying, here's what we set as our goals, here's where we are, here's what we're driving against, here's some help we need, and so on. But provide some oversight, if you will, about the whole regional structure. And then finally, the Bold Goals Coalition is in the process of putting together really a regional leadership team that would provide some really high-level advocacy and support and really legitimize the work on a very broad basis, looking at very high-level kind of community leaders that can help us remove barriers and really help connect this work on a much bigger scale. And that group is being put together now. So the day-to-day activities really of each of the Health Action Partnership doesn't change a whole lot. It really just brings some added resources to the table. One of the things that drives me crazy about org charts is they look hierarchical when you put them out there. And so we've had circles and mountains and different kinds of org charts, but ultimately, you're just trying to get out, here's how the flow works. That it's not necessarily hierarchical, it's still very much of a circular, collaborative effort, but we're adding some resources into it and helping align some of the activities together. When we look at the two efforts, you saw that the County Health Improvement Plan goals that Dr. Wilson just showed up here on the left, and the two broad goals from the Bold Goals Coalition of Central Alabama around improving health behaviors and improving clinical care and health access. And so you see that they line up very nicely, they're very close together, and they're mutually supporting of each other. So we think that from a goals perspective, these things can come together very, very easily. So what's next on the Bold Goals work? Well, in January, and if you haven't gone to, we have a website called theboldgoals.org, and you're welcome to take a look at that. The next step is we hope to have sort of a community indicator report card in January up and running to say these are the metrics we're going to be looking at for our region. And as we start to get data in on those, we will start posting and publishing achievement against goals, against those metrics as we go along. So it'll be a very public, transparent look at how we're doing as communities. Probably not in the spring of 2015, but certainly in 2015. It's very exciting. United Way and the Community Foundation of Greater Birmingham are looking at issuing a joint RFP around health issues that would support some of the strategies that these groups are working on. So we're very excited about that, so keep tuned. You'll hear more about that as we go along. The other thing we're looking at in 2015 is working with local and state health departments to make sure that we're pulling them into the loop, and some of Dr. Wilson's peers in other counties, as well as some of the folks at Alabama State Department of Public Health, to make sure that we're reinforcing and supporting their plans and they're aware of our plans and that we're working together at that level as well. And then finally, just to continue this alignment work in helping align and drive collaborative work among all the various activities that are going on against the common goals that we've talked about. So the good news for all of you is that hopefully there's still going to be a lot of meetings, but hopefully you will see less redundancy in the meetings as we bring these together and start having a more common approach to this work.